In this video, we're going to be talking about the female reproductive organ anomalies, so congenital anomalies. Now, the female reproductive tract originates from the paramesonephric ducts. So paramesonephric is para male, which helps me to remember that it's a female tract. Now, also the Müllerian ducts are also known as the paramesonephric ducts. They are the same thing. So what do these paramesonephric ducts develop? They help to develop the uterus, the uterine tubes or the fallopian tubes, and the upper 1/3 or 2/3 of the vagina. These actually form, so the caudal ends of the paramesonephric ducts fuse to form a uterovaginal canal, and this uterovaginal canal eventually leads to the formation of the vagina and the uterus and the uterine tubes. Remember, it's only the superior part of the vagina which it leads to. Now, these are a few of the anomalies. Just take a quick overview. You can get Müllerian agenesis, which will lead to a blind ending or an absent uterus and an absent pouch. So if I'm more clear, the Müllerian agenesis will be an agenesis, failure to form of the Müllerian ducts, and this will lead to an issue with the uterine tubes, with the fallopian tubes. Then, if there is a partial development of the Müllerian ducts, it can lead to a unicornuate uterus, which is a uterus with a single horn. Here you can see a hemiuterus left over as well. Finally, we have a didelphys, which is a double uterus. Now, these might seem like complex abnormalities that we don't quite understand. So in order to break that down further, we will look at the basics of the Müllerian duct formation. How does it form and how does it develop? Because once we understand that, we'll be more likely to understand these pathologies. So here is the table, and here in the table we can see that the paramesonephric duct was present in males and females, and in females it leads to the development of the uterine tubes, the uterus, and the upper 2/3 of the vagina. The mesonephric duct in both males and females helps to form the ureteric bud, the collection system of the kidney. But in males it also helps to form the seed mnemonic, which is the seminal vesicles, epididymis, E and D. Now, onto the steps of the Müllerian duct formation. So the first step is for the Müllerian ducts to form, and here you can see that there's one on each side. After that, the Müllerian ducts fuse together. Now, there can be a problem if they don't fuse completely. If there's a section of them that's left not stuck together, if there's a section of them that does not fuse completely. After that, you can see on the bottom left picture, there's a septum in the middle. And this septum is supposed to resorb. This septum is supposed to be disintegrated and resorb. However, if it does not resorb, it will leave a leftover septum still visible. So after we've understood those steps in formation of the Müllerian ducts, here are the pathologies that we can see. In the first picture, you see a unicornuate uterus. This means a one-horned uterus, a single-horned uterus. The two horns were supposed to form from both sides of the ducts of the Müllerian duct. If one side of the Müllerian duct does not develop properly, that uterus horn won't develop. So we will be left with a unicornuate uterus. Now look at the second. It's a didelphys uterus. This means a duplex uterus. This means that there are two duplex double uterus systems with a single opening into the vaginal canal. Remember, have a look at the single opening as well. This duplex uterus occurs because of incomplete fusion of the Müllerian ducts. They do not fuse as they are supposed to. So complete failure of fusion, so incomplete fusion. So the Müllerian ducts don't come together and don't fuse properly. And if they don't fuse properly, what does that lead to? That leads to a dual uterus system, which is didelphys. Then we have a bicornuate uterus, which leads to 2 horns, but a single vaginal opening into the vaginal canal. So that is due to partial failure of Müllerian duct fusion. Then remember earlier we were talking about how the septum of the Müllerian duct is supposed to resorb. When this septum does not resorb, we are left with a septate uterus, which is the last picture. It is a septate uterus, which occurs due to failed resorption of the median dividing wall between the 2 Müllerian ducts. And here once again we can see that the paramesonephric ducts come together to form the urogenital sinus, and then they fuse at 10 weeks. Now the resorption of the septum should be occurring at 20 weeks, and this is how the uterus should be looking in a patient who's undergoing normal physiology. However, with a septate uterus, the septum does not resorb at the 20-week mark, leading to a septate uterus. Now for the last part of the video, we're just going to be talking about imperforate hymen. This is when there is no clear opening to the hymen in the female reproductive tract. How does it present? It presents as a young girl going through puberty, adolescent girl, with cyclical abdominal pain, cyclic pelvic pain. And the reason why it's cyclical is because the pain starts to get worse when the menstruation occurs, because at this time the endometrial lining has started to shed, and as the endometrial lining sheds, because the hymen does not have an opening, all that blood starts to accumulate, and if it accumulates in the vagina, this is known as hematocolpus, and if it accumulates in the uterus, it's known as hematometria. And if it accumulates in the fallopian tubes, it's known as hematosalpinx. How on physical exam, what would you see? You would see a bulging hymen, a bulging bluish membrane of the hymen, and a blind ending pouch. You would investigate this with a local exam, pelvic exam, ultrasound, and MRI. So it's a rare anomaly. This is a rare anomaly, although, you might know someone who has it. So the reason why it's cyclical pain, again, is because during the menstruation, that blood has nowhere to go. It has no exit. So it's going to start to accumulate in the vagina, leading to hematocolpus or hematometria. Now, these patients might also have like a palpable physical like pouch or outpouching, like a palpable physical mass kind of, and the treatment would be a cruciate incision. Thank you for watching, and I hope this video was useful, and you can also get urine retention in imperforate hymen.